So today there are 15 new community cases to report, all are in the Auckland region. This takes our total number associated with this outbreak to 855. There is a case that was previously included in the total that has now been reclassified as border related. So the total again is now 855. Of those, 218 cases are deemed to have recovered. There is one case in a recent returnee in managed isolation today as well. Ongoing investigations by Auckland Regional Public Health has resulted in the total number of unlinked cases today being 25, an increase of 1 from yesterday. However, only 2 of today's new cases are yet to be linked, even as of 9 o'clock this morning. And investigations into all unlinked cases continue. That number is expected to fall. The focus of those investigations is very much on the more recent cases, and even if we are unable to link them back specifically to an earlier case, the key thing we are looking for here is that there is no onward spread from those new cases. Analysis of yesterday's 20 cases shows that 19, or 95%, were contacts of known cases, and of those 15 were household contacts already isolating and not active in the community. 5 people yesterday were potentially infectious in the community, with 17 exposure events. Over half of those related to essential workplaces, but those were mostly multiple events associated with 1 or 2 workers being on different shifts. On the hospitalisation front, there are 37 cases in hospital today, all in the Auckland region, and of these, 6 remain in intensive care or high dependency, with 4 being ventilated. I do want to once again just reiterate our thoughts being with those people and their whānau, and I recognise it's a stressful time, especially in Auckland where whānau members are unable to visit. Yesterday there were 13,230 swabs processed around the motu, with 8,566 swabs taken across Metro Auckland. It's very good to see those numbers coming up, and in many respects that's the most important number. It's a welcome pickup in testing numbers, so I want to thank everyone who's come forward to test in the last day or two. Our most important action that can be taken is for us to all be confident that there is no virus still circulating out in the community, to know that the outbreak is controlled in Auckland. So please, if you have symptoms, do get tested.
More than 4 million, or 4,032,710 doses, to be precise, of the Covid-19 vaccine have now been administered. That represents 2.6 million New Zealanders who have had their first dose, including the 366,000 New Zealanders who received their first shots over the last week. 1,379,579 people have received their second dose and have been fully vaccinated. That's really strong progress, and it's testament to everybody's efforts to get it done for themselves, for their family and for New Zealand. As many New Zealanders step out again today for their first day at Alert Level 2, it is important to remember that it's now mandatory to create a record of where you have been if you're visiting certain locations. The New Zealand COVID Tracer app and QR codes are usually the easiest way to do that, but there are other alternatives for those who don't use that technology. We've made it mandatory to keep records so that if there is a case of COVID-19 in the community, it'll be easier to track and locate people based on where they have been. It's a business's responsibility to keep and maintain records of visitors, similar to how bars have always asked for an ID if you're drinking alcohol. So please make it as easy as possible for them when you're scanning in or signing in when you visit their premises. It's happening all over the world, and it's a simple way to record visits, and it will be hugely beneficial to us if we need to contact you. Turning to our managed isolation facilities, I want to again give a really big shout out to the dedicated team of workers in our MIQ who have so far helped around 170,000 people return to New Zealand and isolate safely for 14 days before rejoining our team of 5 million. Since May, everyone going through MIQ has been invited to take part in a survey at the end of their stay. Of the thousands of people who have stayed in that time, 88% found their stay at MIQ was a positive experience. Over 90% said that they were treated fairly and with respect, and 94% said that they felt safe. I acknowledge that for some people it can be difficult to spend 14 days in a room with limited outdoor access. The survey comments, however, tell a story of a friendly and caring staff who are working hard to make everyone staying in MIQ as comfortable as possible. So again, thank you to our frontline border workers and to those working in our managed isolation facilities. They are true Kiwi heroes, and we should all value and appreciate their work. The survey does show that there are some negatives with the system, and it won't be a surprise to anyone that the booking system and difficulty in obtaining a booking is a point of frustration for many people. As I indicated last week, when we are in a position to open up for new bookings, the system will look and feel different. The new virtual lobby, accompanied by greater notice when vouchers are being released, will give everybody a more equal opportunity to secure a booking. We're also constantly looking at how we can increase capacity. I acknowledge that current travel restrictions are challenging for a lot of people, and I want to reassure everyone that we are doing as much as we can to provide a safe passage into New Zealand for as many people as we can safely accommodate without putting our hard-won gains as a country at undue risk. So while we're on the topic of MIQ capacity, an update on the Crown Plaza. Since it emerged that the current outbreak of Covid-19 could have emerged via the Crown Plaza in Auckland, that facility's been the subject of extensive reviews. The final source investigation report has determined that despite significant investigation into potential epidemiological links, the exact chain of transmission from the MIQ returnee is not able to be determined. Audits have confirmed that procedures and ventilation at the Crown Plaza meet the relevant infection prevention and control standards. Modelling by engineers put the risk of infection to the public if an infectious case was standing in the MIQ lobby as very low, less than 1%. Even under a high-risk ventilation and airflow conditions, the technical advisory group concluded that there's no rationale or justification for shutting the public atrium. An Auckland Regional Public Health Service investigation concluded that transmission to a member of the public walking through the public atrium was highly unlikely and negligible. Regardless of these findings, a number of remedial actions have been taken. Further work's been undertaken to seal the public part of the atrium from the hotel lobby. Further work's also being done to enhance the protections around the outdoor area used by returnees for fresh air and exercise. The wall of the walkway, the nearby walkway, is being raised and a roof placed on top of it, both covered with a plastic coating. And the nearby vaccination centre has been moved to a bigger and more convenient site that will help to alleviate public concerns. Changes have also been made further to operating procedures, particularly around how arrivals are processed and how movement within the facility is managed. So the government's carefully assessed all of those findings and the recommendations. We're satisfied that the Crown Plaza can continue to accept returnees. The first cohort going into the Crown Plaza and any community close contacts who can't safely isolate from home are expected to arrive at the Crown Plaza tomorrow. The risk will never be zero, but we are taking the words of the experts that it is negligible. The hotel has served us well and it's been a core part of our MIQ network. Finally today, a word on education. We are ensuring that students around the country, and in particular in Auckland, will continue to be supported if they're facing hard times due to COVID-19 restrictions. Today I announced that we're topping up the Tertiary Education Hardship Fund for Learners with an additional $20 million to ensure that students can continue to focus on their studies and learning despite the disruption caused by alert level changes. So if you're a student, a tertiary student, and you need help, get in touch with your tertiary education provider. They'll be working with the Tertiary Education Commission to ensure that help is provided where it is needed the most. We know the fund's been helping a lot of people over the last year and a half, and we expect that around 15,000 students could benefit from the funding that we're injecting in there today.